An Achilles tendon rupture can be treated either with surgery or without surgery. Depending on the patient and their goals, activity levels, it can help us determine whether they need surgery for the injury. Achilles tendon rupture surgery has come a long way in the past 10 years. It used to be a bigger open surgery where we made a 5-inch incision and we had problems with wound healing and other complications. The state-of-the-art surgery for the Achilles tendon involves a minimally invasive surgery where a very small 1 centimeter incision is used to grab the ends of the tendon, pull the tendon back together, and use heavy sutures or stitches to grab it and repair it. The new techniques with Achilles tendon repair have led to decreased complications and faster recovery. The repair of an Achilles tendon is done as an outpatient surgery. People go home the same day. You're in a cast for the first 2 weeks with no pressure on the foot, and then you go into a walking cast for approximately 2 weeks after that. At 4 weeks after surgery, you go into a removable boot and start physical therapy to start stretching and strengthening the Achilles tendon. And at approximately 8 weeks, you go into a tennis shoe and start gradually increasing your activities. We tend to restrict any explosive or high impact exercise for 4 to 6 months after an Achilles tendon surgery, as there's a higher risk of re-injury or rupture at that time. An Achilles tendon rupture can be a career-ending injury for a professional athlete or a collegiate athlete. As the techniques at Achilles tendon repair have gotten better, the return to play and the ability to return to a high-level activity has certainly improved, but it still can be a career-ending injury.